what we know about the body is that it has its own healing capacity, right? When you cut yourself, the body heals itself. When you go through life, certain processes of healing get interrupted. What acupuncture does is it starts to reset and recalibrate the way that your body is actually doing those processes.
Acupuncture is such a great gate towards other therapies. And I appreciate that so much, because your understanding of Chinese medicine also, to me, it equals understanding of the needs of the body, that it is not only just one channel of help that is needed, but maybe multiple. So many people know about acupuncture. Many people hear about acupuncture, but there are things about acupuncture that I bet you didn't know. And today we are here with a very special guest, Ryan Diener, and we're going to be talking about acupuncture. We're going to be answering some frequently asked questions. We're going to also be talking about integrative medicine and how acupuncture plays a very important role in overall health for patients. So I'm here with the person you already know from our podcast and our doctors networking group, Ryan Diener, VIP acupuncturist, VIP host of Polish Your Life. He is the founder and director of Holistic Health Associates in Frederick, Maryland, and right now also in Boonesboro, Maryland, and expanding. Ryan, welcome again to Polish Your Life. Let's get started.
All right. Thank you for having me. Hi, everybody. Great to be here. Ready to talk shop.
Awesome. Very cool. So Ryan, let's start with maybe a little introduction of who you are and why you chose acupuncture as a profession of choice.
It's kind of a fun story, I guess it's not the norm. Well, I guess most, white guys from the county typically go into a field like acupuncture, right? That would be pretty normal. But no, I was into, a lot of sports when I was younger, played a lot of sports, had a lot of injuries, did physical therapy as a kid, because of just different injuries that I had. Then, fast forward to undergraduate school, where I liked it. I always liked science and I liked the body. I was interested in how things were healing. And so I became a biology major and started to go pre-med, and I was planning to go down the medical school route. And then, as I got further into the undergraduate program, there was just something that wasn't clicking for me. And I think the reason is that when I was younger, I had an aunt, my father's sister, who was kind of like the black sheep in the family, right? She was into astrology and tarot and channeling and all kind of meditation. All kinds of things that most families growing up in the 80s and 90s was a little bit out there, right? So this kind of new age culture was popular in the 60s, then it kind of fell out of favor, but there was still this pocket of people that was into it. And for whatever reason, we had a great relationship. I always really cherished the time that we spent together. And I distinctly remember at 11 or 12 years old, she showed me my astrological chart, all 12 houses, broken down, this is what was happening when you were born as it related to your career house and the family house so it was much more than like, what's your sign, And so it just blew me away. To me, it was like this connection point to some sort of like universal unknown that had just never been introduced to me before. This is not things that you learn in school. And it just kind of led down a road of spending time with her and spending time, she was the first person that taught me how to meditate when I was about 14. And, first person that took me to get a past life regression and go to someone doing channeling and, and tarot and doing all these things. And those are things that as a teenager really opens your mind in a way that, is really, I don't think you can speak highly enough of that. I don't necessarily do those things now in the same way that I might have been really interested in them when I was younger, but at that age, it brings up an entirely different worldview into your sphere that just makes certain things more interesting than others. And when I was going through, undergraduate and I was in pre-med and I was did an internship with a doctor and a podiatrist, and then even a physical therapist. And I was just bored. I just felt like, I was missing some big picture piece of what was going on. And it was because we were just looking at symptoms and we were just treating symptoms. And what what led me to acupuncture was, I was frustrated. I talked to her about it. She literally handed me a book on it's called The Law of the Five Elements. It was a book that was written by one of the directors at the school here in Maryland. I had no idea who she was, had no idea what the five elements were, had no idea what acupuncture was. And I read the book cover to cover in like 2 days. I couldn't put it down. And I just right there knew that the philosophy, the worldview, the ability of seeing health through, these kinds of patterns in pattern recognition, and the relationship between the emotional body and the physical body, and how the external environment mirrored the internal environment. And all these things were so connected to, I think, where my mind was already interested. And so it just pulled me in that direction. And I literally signed up to go to acupuncture school before I had ever received acupuncture. This is very rare. So most people that go into acupuncture, it's a second career, or it's because they had some sort of miraculous experience through receiving acupuncture as a patient. That's what leads many, many, many people to the profession of acupuncture. And for me, it was strictly philosophical. It was just so much interest in already wanting to do something in the health and wellness field, but not knowing where to go. And then this kind of connecting the dots between all the different paths that I had kind of taken to that point.
Wow. This is so awesome. And it's really unusual to go. For example, I talk to a lot of chiropractors. So usually what happens is they have an amazing experience with their own body, and maybe they were, unsure what chiropractic can do for them. And then with that miracle that happens to their own body, now they decide to choose the path. And for you sign up to acupuncture school without receiving one treatment of acupuncture. Very interesting. And it's awesome because it also shows it's not just the act of, putting needles and treating a condition, but what we're going to touch on today is the philosophy behind acupuncture, and what we are really talking about, in addition to like what actually happens. And we're going to talk about it today. What actually happens when you put the needles, because this is not just the needle entering the body. We're talking about the whole cascade of beautiful, positive events that are happening. So this is great. And I'm the guy who, you may be surprised because I didn't tell you that, even though we had lots of conversations. I'm that guy who was in high school trying to spend, maybe 5 hours in one day trying to bend a spoon with my eyesight.
Oh, nice.
Right? I'm that guy because I'm like, I know there is something. And I was reading like all these interesting books, and I'm thinking, it's like, you got to do it. It's like, there are people who do it. It's like, if somebody can do it, you can do it. So I understand the pull towards the unusual, and the conviction that there's something more besides just the physical world. It would be just too simple. So very interesting. And I'm not going to even mention the story about me going to high school in a bus and trying to not blink once for the whole trip and just looking at one point, and that was my way of meditating. So
that's incredible. I should say one other thing about the experience of kind of getting into acupuncture, which is that once I did commit to it and I did go to the begin graduate school, I did have a miraculous experience. It's interesting because for me, it was a secondary piece. I was already interested. I was already going into the field, but I had a skin condition when I was younger. It was, I had a pretty bad eczema and rosacea. And whenever and it was random, it wasn't 100% of the time, but I would get very red and dry skin, like from here all the way through the cheeks. It's very common. They call it the butterfly pattern. And it was especially prevalent in undergraduate and after undergraduate. And I had all these special, fancy, creams that I was using and moisturizers, and it would work for a little while. And then I'd go to a dermatologist and give me hydrocortisone cream. It worked for a little while. Then boom, comes right back. And when I first got to school for acupuncture, I went to one of the teachers who became a great mentor of mine. And for 2 months, I was going twice a week for acupuncture, and I was drinking this tea that we were brewing on the stovetop that made the entire house smell. And I was drinking that every day. And after 2 months, it was like I had never had it. I had been battling it for about 6 or 7 years. And after 2 months, it was totally gone. And so it's interesting. I never lead with that part of the story, because for me, it wasn't the reason that I got into it. It was just it was a confirmation once I did get started, you know?
Yes, 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 yes. So rosacea or eczema is one. So let's talk about conditions, right? What conditions can acupuncture? And maybe we can even elaborate a little bit more later about Chinese medicine in general. What conditions do people come to you with that acupuncture can help with?
Yeah, it's interesting. You know, acupuncture is most commonly known for treating pain. Why? Because many people have pain, and therefore that's where many of the stories come out of. But acupuncture is roughly in the 2,000 to 3,000 year old category, depending on what source you go by. And at that time, there were really no other big forms of medicine. You know, we think of medicine as going to the doctor and allopathic medicine, and yet that kind of medicine really started in, Greece and, and some, in the West. And it wasn't until somewhere in the 16 to 1700s that really started. So we're only talking about maybe 300 or 400 years of what we call medicine, Western medicine. Everything before that was folk medicine, or some sort of other forms. And Chinese medicine was the preeminent form of medicine in the world for many centuries before that. And so, because there were no other forms of medicine that could rival it at that time, there were specialties within Chinese medicine that started long before Western medicine started to specialize. And so it's an interesting thing, because many people don't realize that acupuncture has these specialties within it. We only think of it as a general practice because there aren't that many in the United States compared to the number of medical doctors. And so most acupuncturists are generalists, because there may only be 15 or 20 acupuncturists in your entire town, or less even. And so in order to treat the different people that might be coming in, you have to go and be a generalist in many cases. Now that's changing again. You're seeing more and more specialties within Chinese medicine now. Over the last probably decade, I've noticed it quite a bit more, and to the point where, like in our office, we have subspecialties. So we have 7 different acupuncturists, and each one kind of has different, because you get drawn to different things. You do different continuing education. You start connecting with different types of conditions through the patients that you're seeing. Then you want to see more of that condition, so you do a good job, and then they refer different. So before you know it, you're seeing all pregnant women for fertility. We have one woman in the clinic. She sees many fertility patients, and we've had many babies that have been. We have all these baby pictures that are a result of the different work that has been done, acupuncture and herbs, to help a woman go from fertility through pregnancy to conception, and then even into postpartum. There's a whole series of different treatments that you do for that time frame. So women's health, fertility is a big specialty within Chinese medicine. Obviously, chronic pain is so common. It's the most common thing that we see, without a doubt. My subspecialty is in gastrointestinal and autoimmune conditions. I work with a lot of digestive disorders and different cases that people come in with: inflammatory bowel conditions, Crohn's disease, colitis, different things, acid reflux, different things like that are part of many people's experience as well. We have a practitioner on staff who works with oncology. He has an oncology specialty. So with oncology, you're working with side effects from chemotherapy. You're working with side effects from radiation. You're working with strengthening the person's immune system. You're working with neuropathy, all the results of chemo and cancer, and then trying to build the person back up after chemotherapy to try to strengthen their system and help them recover and help their tissues recover. So there's a host. I mean, we do allergies. We do a lot of allergies and headaches. That's a very common one for acupuncture: migraine headaches, allergies, especially in this area. We have a practitioner that focuses on anxiety and insomnia. And so we send a lot of the patients that are coming in with high stress levels to that person. And so the beautiful thing about Chinese medicine is you have this crossover between these psycho-emotional aspects of the medicine and then the physical aspects of the medicine, and bringing those things together and helping people to see a different pathway forward with all these different conditions that it can be effective for is just, it's a joyful field to be in. There's no question about that.
That is great. And, if an average town has 15 acupuncturists and you have 7, that's pretty cool to have, almost half of your town acupuncturists are part of your team. I know in Frederick it may be more, but it's awesome because you are able, and I just know more than some of our viewers, you are able to have a team building initiative where everybody can treat the types of patients where they feel like they are the best at treating that. They also enjoy the results. And also, once you have experience and confidence in treating a condition, then you want to help more people with that condition. And you believe that this is possible because from experiences like this. Tony Robbins talks about these circles that basically one affects another. And this is a positive feedback loop that you have. So that is very good. Now people know, for those of you who didn't know, that there is a wide range of different conditions that acupuncture can help with. And this is talking to not only individuals, but also providers, because as a provider, you are treating a specific condition, and maybe you get to a point where the patient is not getting better. Maybe you feel like they got better to a certain point, but they plateau. And maybe there is this energetic component or psycho-emotional component that you talk about that is needed to get that patient better. So keep in mind in terms of referrals between offices, and we're going to talk about that as well. So, so you put the needle, as an acupuncturist, you put the needle in, right? Mm-hmm. And this is what people see on the outside. There's a body, there's a therapist, acupuncturist, and then there is this needle. The needle goes in. What actually happens that this works so well?
Yeah, no, this is the $1 million question that everyone wants to know. It's like, how could this possibly do anything? You're taking this little tiny pin and you're sticking it in a half an inch into my body, and then you put in 10 more, and then that's it. But what we know about the body is that it has its own healing capacity, right? When you cut yourself, the body heals itself. There are certain things that the body does really, really well in order to maintain its function. And when you go through life, certain processes of healing get interrupted because of all the different things that we know. Could be dietary imbalance, could be lack of exercise, could be over exercise, could be trauma, some sort of injury. It could be high stress that leads to some sort of shift and change internally in your physiology. And when those things happen, it inhibits your body's ability to do its job, to do the things that it's good at. And it doesn't mean that it can't do it at all, but it means that things can get progressively less effective. And so that's when you start to see chronic issues, things that should have healed after 3 or 4 weeks, and it's 3 or 4 months, and then it's 3 or 4 years, and you still are dealing with this problem. And so that is just kind of like a context for how does this work. I just want to kind of start with that, because what acupuncture does is it starts to reset and recalibrate the way that your body is actually doing those processes. So for example, if you have chronic pain in your elbow, we call it chronic tendonitis or chronic tendinosis, right? Now, there are certain aspects of the elbow that are now chronically inflamed. So what are a few pins going to do to that area? What we're trying to do is what's called a pattern interrupt. We're trying to interrupt the pattern that the body has now accepted as normal, and then create a change. Well, when you put a pin in your body, the body thinks that there is some sort of, that's a sign that it has to create a healing mechanism. It's being pulled, just like if you touch the stove and then all of a sudden your pain receptors hit, you pull your finger off the stove, your body starts immediately sending white blood cells, all kinds of fluid to that finger in order to help the burn heal as fast as possible. If at some point there has been a chronic pain that has been lasting for so long, the body has kind of like gotten numb to it, there's nothing else that it can do. It thinks that this kind of inflammation is the norm, and so it's exhausted to try to heal that. When you actually initiate the pin into the body, it causes that chain reaction to get restarted. It's like it's like when you turn the lights, turn the car, the motor over in the car. It's like vroom, 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 and it's like finally, it started to work again. And then you start to see little, the inflammation start to slowly go down. So it has this anti-inflammatory effect through the process of reinitiating the body's natural anti-inflammatory process. It has this kind of, it goes back and resets, recalibrates the way, so it does it backwards. It calms the flames, but it also works on the signaling. So when you put that pin in, it's sending a signal through the nerves in that area to the brain to say, hey, we need something to happen here. We need some healing here. And the brain says, oh, something has penetrated my skin. That's a problem. I need to do something about it. And then all of a sudden we have a new process that's been reinitiated. And so that is one major way to think about how acupuncture is working. Anti-inflammatory effect through the nerves that connect, we call them the peripheral nerves, that connect to the brain and then come back down to the area through which you have instigated that change, right? And we know that the body is connected. So the fascia throughout the body, we just had a call recently with Darlene Bergner, and so we talked a lot about the myofascial release. And fascia is like this layer of connective tissue that it lays over all the muscles. And there are little nodes of electricity within the fascia that are not part of your nervous system. They're considered to be independent electrical nodes within the musculoskeletal system. And many people believe that the acupuncture process is actually regulating that electrical process as well. The fascia, the nodes that are along the fascia, that process of regulation of those electrical nodes is another way that this is affected. So we have an anti-inflammatory effect. We have the relationship between the peripheral nerves and the brain. We have the fascia, the electrical nodes along the fascia. And then lastly, there's two more. One is the circulatory effect. So it increases or decreases blood flow to an area, usually increases, right? So you're trying to bring blood carries oxygen. It carries all different types of molecules that help to heal tissue. And so you're regulating blood flow to a particular area. So that's the fourth thing. And then very last is the relationship between different gases and chemicals within the body. So one of this more recent areas of study within acupuncture where they're showing what's happening is measuring levels of nitric oxide. And nitric oxide has always been this thing that has been somewhat kind of nebulous and unknown. And then it became very popular and everybody was doing these nitric oxide hits to try to increase their nitric oxide because that's where you get an increase in energy from. And it's good for muscle, for workouts and things of that nature. But you can have too much nitric oxide and that typically causes inflammation. Or you could have too little nitric oxide and that causes weakness. And so there's a regulatory process that easily goes out of balance. And one of the things that acupuncture does is it allows the nitric oxide gas and hydrogen sulfide to release from the body through the skin and to encourage an increase in that area. So it has this regulatory effect that's been measured with many, many different studies on PubMed and on all kinds of different areas on the net that you can find at this point in time.
This is pretty amazing because we are talking about something that seems so simple, right? It's like sticking a needle into somebody's body. And I know there's a science behind it because it's not only sticking a needle, but also what type of needle, where you place it, how you place it, how many you put, in which areas, what's the period of time, how often you do it. There is a lot more. And I know that there is also another layer of how advanced acupuncture can be, but it's just pretty amazing that a process like this can trigger so many effects. And then there's a bunch of people proving that the science behind it is working so well. So I'm always fascinated by this. And I'm also fascinated because one of the acupuncturists that I visited in Rockville, she was explaining about the compounding effect of acupuncture sessions over time. If you can talk about this one a little bit as well, because that's something that I didn't understand. I thought that this is something that you do, like, for example, you need you need to get a drink, so you get that drink, you drink, and then and now you're done. But what she was explaining is that there's a compounding effect of the sessions. If it's done over time, then you basically raise the baseline, which helps you maintain better health. Let's talk about it.
Absolutely. No, it's a great point. So the compounding effect of acupuncture, and what you'll notice for those of you that have never been to an acupuncturist, is that most acupuncturists that really know how to help you are going to give you a plan of care. They're not going to just tell you come in once and then good luck. You're coming in with something that's been bothering you for many months, many years, at times. Your body has gotten into a rut, a mode of operating that isn't the healthiest. It is functioning at the way that you want it to function for your lifestyle, right? So when you go to start treating someone, you have to reverse engineer that process. So your body has gone from, so here's the body, right? And everything's perfectly normal. And then over time, your body is compromising and making adjustments all along this way for things that you're doing to it, until all of a sudden there's pain. But there's a long process that you've gone through before finally it's gotten to be so compounded that you now have this pain problem. So when we go and work on getting you feeling better, that could take only a few treatments. I mean, many people feel better within a few treatments, or at least have some improvement within a few treatments, I should say. You're probably here. So then you have so everything's going okay, and you say, oh, okay, I'm good. I'm gonna, then you get a little bit of stress. You take a little trip, over a curb, and you think everything's fine, but why? Oh, it started hurting again, or you get through a stressful time at work, and you're having to do extra work for one of the people there, and you're staying up late and you're not sleeping as well, and now all of a sudden that pain comes back. Look how far away you are from where, from pain. You're this close. We want you to be over here. And so there is a compounding effect in two ways. One is, in some cases, the pain has been there for so long that you have to recalibrate, reset. It's like a training process, right? So you're taking the body that's gone from A to M, and now you're trying to retrain it back to A, right? Just to get out of pain and to have it stay, throughout the day. But then there's also, okay, now we finally did that. So that's a compounding effect over time. The same pattern goes in your body. The same pattern of pins goes in your body. It's sending the same signals to your body. The body goes, oh, okay, I get it. I need to change the way that I'm flowing, that I'm operating. The way that my nerves are sending signals here is not working. I need to change that. And then you go home, and it starts to kind of creep back in. Then you go get another treatment. Oh yeah, I remember this. Your body says, I'm gonna go from here now and go a little bit further. And then I'm gonna go from here and go a little bit further. And then go from here. And what you're doing is, once you get out of discomfort, or you get, some improvement, now what we're trying to do is create some space, some breathing room, right? A buffer, so that when you do get stressed, now you have this much room to work with before you end up in pain again. So that piece is, so what I'm describing are the phases of care, right? The acute phase compounds on itself, or the corrective phase, as a lot of chiropractors call it, compounds on itself until you're out of pain. Then we have to stabilize so that under stress, didn't sleep well, got a cold, instead of it just jumping right back here, we want to get a little bit of space. You're stable now because, now things can move. It's not going to come back just because you got a little head cold. Then we move into the third phase, which is wellness, which is now we're getting stronger. We're reverse engineering this process back. And now look how much space you have for stress. And one of the best things I was ever told is, and that I've never forgotten, is that, the goal when it comes to stress is not to relieve it, or not to avoid it. The goal is to be able to carry more of it without it becoming a problem. And so that statement has stuck with me my entire life. I mean, to me, it just is the epitome of everything that we're trying to create here. When you create this much room for stress, now you think about how much more giving you can be to the people around you. If you're here and you get stressed and then boom, I'm in pain and now I need help and I need help, you become someone who needs people's help. And that's going to happen, right? Of course, we all need people's help at different times in life. But if you're satisfied with that, I'm not satisfied with that. I want to have so much room for stress that I can handle so much of it that I am more of a contributor to the people in my life than I am a detractor from the people in my life. So
powerful. And I mean, who doesn't have stress?
Right.
Especially when you talk about, having that buffer, it makes a lot of sense. And I think that when it comes to treatment, people receiving acupuncture sometimes may have a challenge understanding it, that now with workouts, for example, that's easy to understand, because yes, I know I'm not going to change my body with the first best workout with the best personal trainer. One workout is not enough. Two, probably not enough. You need a sequence of events. When you're coming to an acupuncturist, or if you're coming to an acupuncturist for pain, because that may be one of the reasons why you showed up, when that pain is gone, I think it may be a little bit challenging on the provider side to make sure that you educate on, what we are doing is not only getting you out of pain, like you mentioned, that would be one of the last things to show up, and maybe one of the first things to go away, which is what chiropractors say as well. We are going towards giving you that buffer. So a little thing is not going to immediately get you back in pain. And also we are working towards correcting the reason why you were in pain in the first place. So when we talk about the cause, that's when we go into collaboration with other providers, because it may be, many different types of therapies that are needed. I wanted to expand this, if you don't mind, this concept of acupuncture to Chinese medicine in general, because while we hear these terms, acupuncture, Chinese medicine, for a lot of people, including myself, I feel like my knowledge is really incomplete. So what is, obviously, this is not the same, acupuncture and Chinese medicine. Acupuncture is part of Chinese medicine. So
That's right.
Explain that umbrella of Chinese medicine so people know what other things are there, and maybe it gives a very good context of what role acupuncture plays in Chinese medicine.
Yeah, no, it's fantastic. It is true that the thing that attracts me to a field like this is, number one, this relationship between, right, the physical and the emotional and the even the spiritual, if you will, but also the concept of Chinese medicine takes health into a full account, where you are looking at acupuncture, which deals with physical signaling through the body, right? Signals that are going through, electrical signals that are going through the body. So that's one aspect of Chinese medicine. You have herbal medicine, which you take herbal supplements, and just like vitamin supplements, but they're tailored specifically to the types of conditions that you have. So for example, there are at least a half a dozen formulas I might use for acid reflux. Where in allopathic medicine, you basically get Nexium or you get Protonics, and they're both doing the same thing, right? It's just which one does your body tolerate better. With Chinese medicine, there are usually 6, 7, 8 different formulas that are all, more refined and differentiated for the specific aspect of the thing that you might be dealing with. So that's kind of food is medicine, right? We have that component of it. Then you have movement, which is traditionally through Tai Chi and Qigong, and which are just forms of martial arts, forms of body movement and breath work within the field, so that have led to many of the different martial arts traditions. You have medical massage or manipulation. So nowadays we allow the chiropractors to do that, of course, because that's their specialty. And we have massage therapists at our office and we let them do the massage. But there is traditionally, massage and manipulation was all part of this tradition 2,000 years ago, so it's all part of that picture. And then lastly, we have meditation and breath work. So, letting, the connection between both the body and the mind is your largest belief in what's out there, right? Whatever that is for you, God, the universe, whatever that is, and being able to release into the bigger picture and kind of recognize yourself as part of, a vast process. It allows the body to relax in a way that I can't quite describe how powerful it is. I can't even stress enough the value that it provides when you can separate yourself from your body for a moment and just let that level of space and largeness come into your sphere, and just realize that you're part of this bigger process. And the things that, it just changes the perspective that you have. And it lets your entire nervous system, your entire adrenal, system relax in a way that is just unbelievable and incredible. And so that is the fifth aspect of Chinese medicine. So those five aspects, if you think about holistic care, you can't be any more holistic than movement, food, body work, and meditation. Those aspects that can have this just overall effect. It's kind of like, if you're building a room, you can't just have a hammer. You have to have a drill. You have to have, a putty knife. You have to have a paintbrush. You have to have these things that are going to allow you to really finish it in a way that is complete, as opposed to kind of like partial. And that's what a full picture of Chinese medicine does.
I love it. And when we talk about integrative health, this is exactly what it is, because you're integrating different tools, different ways to help people, customized to what the person needs. And then you have a lot of them in Chinese medicine. And whatever you don't have in Chinese medicine, you also work, because I know you also work with medical community, with chiropractors. It's pretty amazing that acupuncture is such a great gate towards other therapies, just like chiropractic is. And I appreciate that so much, because your understanding of Chinese medicine also, it is, to me, it equals understanding of the needs of the body, that there's not only just one channel of help that is needed, but maybe multiple. And then whatever I don't have here, I already know that may be needed, versus some providers that just focus on that one tool. Let's say I have a hammer, I'm looking for nails. What if that's not exactly what is needed? Because, we need to adjust it, right? Talking to our friends, chiropractors here, if we need to adjust it, that there is going to be a different tool needed. So when I know the answer to that question, but this is the first question that I get when people, when I share that I had an acupuncture session. What do people say? Guess which question they ask me.
Did it hurt? Did it hurt? How could you do that?
So yes, let me ask you that question officially. Does it hurt? Does acupuncture hurt?
So I will answer this question diplomatically, because I've had to answer it so many times. When you get the question, it makes you want to scream at the top of your lungs. It doesn't hurt. You know what I mean? Because the majority of people don't either don't feel it, or they feel it, but they're so surprised at how minimal it is, that all of the fear, all of the workup that you have gone through, kind of questioning, wondering, creating limits in yourself to try something that could be so helpful, because you're so afraid that it's going to give you a little bit of discomfort, is so overblown in relationship to what you actually feel. And almost everybody comes in and they ask me this question. I've never had this before. I'm a little nervous. It's going to hurt, and before I do anything, I say, let's come over here. And I just take one and I put it in, and then I take it out, and they're like, that's it. And I said, yeah, that's it. That's what you're going to feel. You might feel 10 of them, you might feel 15 of them, but that's what you're going to feel. And they were like, oh, okay. And then I start the intake, because then all, they can relax, and all of that block that's still in there, and this is people who have already come into the office. I can, there's thousands and thousands and millions of people who are out there who are not trying this for the same reason and wouldn't even consider it. The people that are in the office, they've already gone out of their comfort zone enough to come into the office. You know what I mean? That's already an amazing, risk for a lot of people, the way that we think. But there's almost everybody is so shocked. I mean, I treat my 9-year-old. I've been giving him acupuncture since he was a baby, literally a baby. And, he's been having some trouble sleeping, and I've been treating him, and I use 5 needles on him. And now he asks me for them. He says, oh, can you put this one here? And I'm like, yeah, well, I'll tell you where they're going to go. But yeah, this is a good one for sure. And so, and then what that does is it takes that whole block, just like we create blocks in our minds for so many things over the ideas that we have before we actually experience them.
Especially if we don't know them and we've never experienced them. It's just like a dark room, right? You walk into a dark room, it's scary. I don't know what's there. Maybe the most beautiful place, but because you've never been there and it's dark and you cannot see it, it's new. Yeah, you're naturally afraid. So I understand the mechanism. I was curious how you're going to answer that question to make people feel comfortable. There is one thing that no acupuncturist tells you that you should never do. And I will tell you what that is. So when you have all the needles, because it happened to my mom, so I just have to, sorry, mom, I have to share it. So she got an acupuncture session, right? So she gets all these needles and she's just laying down and she's like so surprised because she says, it actually doesn't hurt. And she was so afraid, right? Yeah. And then guess what happens? She sneezes.
Oh, no.
She says that was definitely something she would not recommend. So
that's right.
Please get acupuncture when you need acupuncture and try not to sneeze. So
you will feel in that situation because the points are going in just far enough to stimulate neurons in your nervous system. But if you move a lot and it changes the angle of the needle, sometimes you do feel almost like an electrical sensation, but it's not it's not the word. It goes away in a second. You know what I mean? So it's like a funny.
She was just saying that as a funny story to share with me, and she says it actually doesn't hurt except this one moment that because somebody opened the window and there was this. Usually, what's candles can be involved and the smoke and this smoke gets in and you're like, oh, it's happening, and it did. So just wanted to share it. Sorry, mom, but I think it's going to help people relax when it comes to acupuncture. Just don't sneeze. Yeah. So now that we have that out of the way, because I think it's an important one for people to hear. So that is for providers out there and also for patients out there. Let's say you are looking for a acupuncturist and you're like, okay, maybe I'm in California. I'm not next to Ryan and I would like to go and see an acupuncturist. How do I know which one is good? So that's a question for you, Ryan. How can people know? Let's say they start with, I don't know, a Google search, or they start asking around. How do I know if this is going to be one of the Ryans in the world, or is this going to be somebody who, maybe took a quick course and watched a couple of YouTube videos and I'm going to be their first patient? So how do I know?
Yeah. Well, first I should say that the first thing you're going to, of course, look for is licensure. If somebody is licensed, and they have a license number and they are, licensed by the National Commission for Acupuncture in the United States, then there's a governing body for the nation, and then there's a state licensure. So if you have somebody and that they have a license that from the national board and from the state, then you can be sure that they went to a 4-year postgraduate program. They went after undergraduate, they went to a 4-year program, graduated. So they couldn't have taken a weekend course with a YouTube video unless they are a medical doctor, or some, there's, chiropractors and physical therapists have some abbreviated courses that they can do. But to be honest with you, these days, most of those professions don't really, do that much as acupuncturists. And so, for the most part, if you see a licensed acupuncturist as the credentials, then you know that they're not going off of just YouTube videos. That's just baseline, right? Then the next thing that I tell people to look for is in their bio, how much postgraduate, and when I say postgraduate, now I'm talking about postgraduate school, graduate studies did they do? Did they study with a mentor? Did they have someone that they spent a couple of years apprenticing under, or learning a particular, theory from? There is so much to learn in Chinese medicine. There's so many styles, and coming out of a 4-year program sounds like a lot for a master's program. It's one of the longest master's programs in the entire educational system. But then what many of us do is we realize that that's just kind of the tip of the iceberg. There's such a vast depth of knowledge after a couple thousand years of this. And there's so many different ways of seeing human beings in front of you and looking at them and trying to find, really find the key that's going to unlock the challenge. That if you don't have a fair amount of postgraduate study, then I would question I would question that. It's one of those things that I really always look for is somebody that's hungry to learn more, because it's such a deep knowledge. There's so much that you can learn to help people. So if there is a lot of information about postgraduate studies, then that's something that I would encourage people to, kind of go towards a practitioner like that. Obviously, if you have a particular specialty or a particular condition, and there is someone with a specialty in your area, then that's also worth looking at as well. Obviously, that is something. But if you're looking for someone that can be more of a general practitioner for you, then you'll want to look for someone that has that does not have a specialty, but has done a lot of postgraduate studies. So that's usually what I tell people as kind of a starting point.
Got it. And thank you for explaining that, because for a lot of people, acupuncturist and acupuncture office can be, can look the same, especially people get confused. They see, for example, listings on Google or in any, search engine, and they don't know which one is good. So then what you do is, what I'm understanding is, you look at, okay, who is licensed, right? So they need to be a licensed acupuncturist. You also see what type of postgraduate training they had. Maybe, watch a couple of videos if they have some videos, but also see if there is a specific condition that you're coming there for, see if they specialize in that condition. So that is great.
I would say one last thing about it is,
Okay.
is just, that you should expect to work with the person for a little while, for a few months. And so you do want somebody that that you feel like understands your condition. And so it's not the worst thing in the world to try someone out, for a few times. It's, and if it doesn't seem to be a good fit, then to switch. Just because it's not working from one practitioner, like I said, there's so many styles and there's so many different methods through which we can work just through the lens of acupuncture and herbal medicine, that don't be afraid to try it again if the first time around it just didn't work for you. And so, herbal medicine is another thing that I tell people to look for. If someone has been trained in both acupuncture and herbal medicine, that can give a second tool. Not that there aren't great acupuncturists out there that don't do herbs, but it just gives a second tool that the body that can help you recover faster.
Very helpful. And I think that's going to give a lot of people peace of mind, that they need to sometimes, and you know how it is with all the new things, you need to make a decision, take a step forward. And what you're saying is that even if you made a mistake, you can always pull back after a few visits and say, hey, maybe this specific practitioner is not the best fit for me. but at least make a choice and test if something seems like a reasonable solution. So that is great. I wanted to ask you one more question before we go, because that ties into the purpose of our group, our integrative healthcare community. And that's something that we talked about before we started recording. That is that some patients come in, and maybe that's you watching, that you are wondering, say, hey, I may consider acupuncture, and I will do that after because I'm currently under treatment with physical therapist, pain management doctor, chiropractic doctor. And we talked about it, and we talked about the concept of integrating different therapies in time and how to do it effectively. I definitely would like to speak to these people. At the same time, keep in mind that we also have practitioners watching who may want to refer to you, but they may want to refer to you maybe if there is failed treatment or a plateau, and only then, where I think it would be a very good idea to consider, kind of like a combo effect, where we have this compounding effect of acupuncture plus the compounding effect of multiple different therapies working for the best results of the patient. So let's talk about that.
Definitely. We all have our different strengths, and we also have our own biases towards what we can do. And we also have our own weaknesses because of that. And so, there's some obvious things that you can see, right? Acupuncture is not going to have the immediate effect that a chiropractic adjustment might have on the structure of the body. But the chiropractic adjustment may be much easier to perform. And if the person is also getting acupuncture, to release some of the tension in that area and to start to allow for the structure to move a little bit better, because of, so to your point, how do you integrate these things in a way that makes sense? There's nobody out there. This is something that, is missing, that if anybody is out there that's going to create the next phase of healthcare, you want to create some way that there is an integrator for all the different modalities that someone could go through, because that's something that's missing. A lot of patients ask for it, like, who's going to be my quarterback? Who's going to, help me decide these things? And what we tend to, the way we work with other providers is that I try to be very upfront with them and just say, look, for the benefit of the patient, no patient is going to come twice a week for chiropractic, twice a week for acupuncture, twice a week for physical therapy, all at the same time. So what we have to do is recognize who's going to be the primary and who's going to be the secondary in any given relationship. If I know that somebody is already seeing a physical therapist twice a week, and they are coming in for acupuncture, then what would normally be a 2 to 3 session a week plan is usually a once a week plan. Not because I don't think that they could benefit from 2 to 3 times a week, but because you don't actually want to overload the body, number one. But even more importantly, nobody has time for that. Like, you realistically, lifestyle wise, I mean, just speaking, for real life right now, from somebody that's a busy, working professional with a family, like, you're not going to get a treatment 6 days a week. There's just not going to happen. So we have to find ways to work with each other so that the patient benefits from the addition of these different modalities without the competition or the internal battle that the patient is trying to decipher for themselves. Oh, well, he said 3 times a week, and he said 3 times a week, and I guess I have to pick one. It's okay to take a secondary role from time to time. So if I'm seeing somebody 3 times a week for acupuncture, and I think that they could really use some massage or some chiropractic adjustment, I will ping the chiropractor and I'll just say, hey, I'm still in a corrective plan with this person. I just think that they could really use some adjustments. Can you just give them a weekly or give them a biweekly, just to help kind of speed the process up along? And then it can come back in reverse, where the chiropractor says the same thing to me. Or, I just know that there's certain people that if they send the person to me, I just ask the patient, hey, are you still in a plan with Dr. So-and-so? Yeah, I'm still seeing him twice a week. Okay, then here's what we're going to do. And I explain it to the patient. Normally I would give you a plan 2-3 times a week. Now I'm going to be giving you a plan once a week, and this is why. And so this is a really important way, I think, that we can work better with each other as providers to, and really, I think it benefits the patient so much more than waiting. I'm going to finish this plan and then I'm just going to try acupuncture. It's like, no, that's not as effective in a lot of cases, especially really complicated chronic cases. It can be so helpful to combine services. We just can't expect that we're all going to be the quarterback of that person's care for that next 3 months, you know?
Of course. And the patient would get confused as well, because you're getting conflicting information where everybody tries to be the quarterback. And that's not exactly how healthcare works and how life works, really. So pay very close attention to what Ryan said, is because this is not only kind of like a general idea of how acupuncture can be integrated with other modalities. Yes, that's kind of like how we phrase the question, but this is really the answer to how healthcare should be performed. And we are talking about this lack of quarterback. I take it very personally because, you know, Ryan, our story, and you know that this is a big problem, that so many people go from doctor to doctor. They follow recommendations and some of them don't get better. And now what? Now you actually need to have that quarterback. And the closest that we have ever gotten to having a quarterback is to work with integrative health practitioners. And that's because whoever you see as a patient, if you're a patient watching, individual watching, whoever you see, if they actually are integrated as a practice and with the integrative healthcare mindset, they're going to keep in mind your best interest, and they're going to refer you to the next logical therapy that should be in the mix. So you don't necessarily have to worry about finding the perfect quarterback here. Just find an integrated provider. And that's who we have here in the group. Look at Ryan. We are not talking about the concept that we want to implement. We are talking about the day-to-day operations of his office and the offices that he has now and the offices that we have witnessed in working together with. It's amazing to see how that can work. It can work for you if you're a practitioner as well, because you're not alone. And I've talked to a lot of these practitioners that they're so busy that they don't have time to research who is next to them, who is very good, who can collaborate with them, who has what mindset, who has time for that. So as Polish Your Life, as our integrative healthcare community, doctors networking group, however we call it, we are trying to bring these good people together. And then you can ask a question here when you're watching a video like this, and we will try to direct you to the right place. What makes logically, the most sense? And if it's not the best place for you, just what Ryan said, you can always pull back after a couple of visits and say, hey, this may not be the best solution. Just one thing I want all of the individual watching to have is hope, because there is hope. And a lot of times you're going to hear from one of the practitioners that you can do nothing, diet has nothing to do with it, the energy stuff and the spiritual stuff, emotional stuff, this is the witchcraft and all the stuff that is, that is for kids. No, it's not. It's science that maybe some people don't understand, but that's kind of like the same thing. Like people were thinking that the earth is flat. Some people still do. I question that. So thank you so much, Ryan. Tell our viewers, patients and providers where they can find you.
Sure. Yeah, you can. So website is HHAMD, like Maryland.com. Facebook at HHA Frederick or HHA Boonesboro, and Instagram at HHA603.
Thank you so much. Ryan, you are awesome, and our viewers learned a lot today. If you're watching this and you haven't subscribed to our YouTube channel, please subscribe to Polish Your Life YouTube channel and HHA, Holistic Health Associates as well. We have a lot of collaboration videos. Ask questions in comments below if you have any questions. If you're watching this on YouTube, please follow us on YouTube and other platforms. We are doing this because we have awesome practitioners like Ryan Diener here. So everybody have a great day. Ryan, thank you again. All the best.
Pleasure as always. Thank you, Mike.